As we journey through life, our shared goals for your health begin to evolve. The focus naturally shifts from a strategy of prevention at any cost to one deeply rooted in preserving and enhancing the quality of your daily life. Medicine is not a rigid set of rules applied uniformly to everyone. A test that was essential at age 50 can become an unnecessary burden at 70, and it's crucial we recognize this shift. Today, we'll have a frank discussion about 5 medical screenings where it becomes wise to pause and reflect after you've crossed the threshold of 70 years. This isn't about a number on a calendar. It's about a conversation centered on your overall health, your personal values, and what truly matters to you at this chapter of your life. The first of these is the colonoscopy, a screening for colorectal cancer. For many years, it has been the gold standard for detection, and for good reason. However, once we move past the age of 75, the balance of its benefits against its potential risks begins to change significantly. The primary benefit of a colonoscopy is the detection and removal of polyps before they have a chance to become cancerous. This transformation is not a rapid one. It is a slow process that can take a decade or even longer. Therefore, if an individual's life expectancy is less than 10 years, identifying a slow-growing polyp may not alter their life's course in any meaningful way. Instead, it might expose them to risks that are simply not necessary. These risks become more pronounced with age. The preparation for the procedure is demanding, requiring the consumption of large volumes of liquid laxatives. This can lead to significant dehydration and imbalances in the body's electrolytes, a dangerous situation, especially for individuals with underlying heart or kidney conditions. The procedure itself, while generally safe, carries a small but real risk of perforating the colon, causing bleeding, or leading to complications from the anesthesia. For an older adult managing multiple chronic health issues, these risks are amplified. The decision, however, is not absolute. If you are in excellent physical condition, remain highly active, and have every expectation of living another decade or more in good health, then continuing with periodic screenings could be a perfectly reasonable choice. More importantly, if you are experiencing concerning symptoms, such as rectal bleeding, a persistent change in your bowel habits, or unexplained anemia, then a colonoscopy is no longer a preventative screening. It becomes a vital diagnostic tool we must use to find the source of the problem. The consensus from most medical bodies is to individualize the decision after age 75, typically ceasing routine screening altogether by age 85. It's a dialogue about your specific health landscape. Next, let's discuss the prostate-specific antigen, or PSA, blood test for prostate cancer. For decades, this simple blood test has been a frontline tool. Yet, it is also one of the most controversial screenings in medicine, particularly for older men. The central issue is something we call overdiagnosis. The PSA test is highly sensitive and often detects very slow-growing prostate cancers, the kind that would never have caused any symptoms or posed a threat to life. But the moment the word cancer is introduced, a cascade of anxiety and medical procedures is often set in motion. This diagnosis frequently leads to a series of interventions, painful biopsies that carry a risk of infection and bleeding, followed by treatments like surgery or radiation. These treatments have significant and often permanent side effects, including urinary incontinence and erectile dysfunction. For a man in his 70s or 80s, the daily impact of these side effects on his quality of life can be far more detrimental than the presence of a dormant cancer he would never have known about. The guiding principle here is to screen for diseases that are likely to shorten a life, not to find diseases that a person will ultimately die with but not from. Here, too, exceptions are key. A very strong family history of aggressive, early-onset prostate cancer might justify a continued conversation about testing. Furthermore, if symptoms develop such as difficulty urinating, blood in the urine, or new unexplained bone pain, the PSA test shifts from being a screening tool to an essential part of a diagnostic workup. The third screening to reconsider is the mammogram for breast cancer. The mammogram is an invaluable instrument for early detection, credited with saving countless lives. But its utility becomes less clear-cut as a woman ages and accumulates other health concerns. Similar to prostate cancer, the risk of overdiagnosis is real. Many cancers detected in older women are slow-growing types, such as ductal carcinoma in situ or DCIS, which may never progress to become life-threatening invasive cancer. Beyond this, false positive results are common and can create immense psychological distress, leading to a battery of follow-up tests, including biopsies. For a woman managing several chronic conditions, the physical and emotional toll of these additional procedures might outweigh the benefit of finding a cancer that was unlikely to cause harm. Medical guidelines vary, but a common thread is that screening should continue as long as a woman is in good health with a life expectancy of at least 10 years. After age 75, the decision becomes highly personal, a careful weighing of potential benefits against potential harms, made not by a guideline, but through a thoughtful conversation. The fourth on our list is the Pap smear for cervical cancer. This screening is one of the greatest success stories in the history of preventive medicine, drastically reducing deaths from this disease. But there is a well-established point at which continuing the test provides little to no additional benefit. Major health organizations recommend that women can safely stop having Pap smears around age 65, provided they have a history of regular, negative tests over the preceding decade. The reasoning is sound. Cervical cancer develops very slowly and is almost always caused by the human papillomavirus, or HPV. If a woman's tests have been consistently negative up to her mid-60s, her risk of developing cervical cancer later in life is exceedingly low. Continuing to test beyond this point yields very few meaningful findings and can lead to unnecessary procedures. There are, of course, important exceptions. A woman should continue screening past 65 if she has a history of a high-grade precancerous lesion or cervical cancer. Also, if she hasn't been screened regularly in the past, a discussion about continued testing is warranted. And for women who have had a total hysterectomy, including the cervix, for non-cancerous reasons, there is no need for Pap smears at all. Finally, let's talk about the bone density scan, or DEXA scan. This test is used to measure bone strength and diagnose osteoporosis, which is critical for preventing fractures. However, once a diagnosis of osteoporosis has been made and treatment has begun, the value of repeating the scan frequently diminishes. After starting treatment, our primary goal is to reduce your risk of falling and breaking a bone, not necessarily to chase a specific number on a report. The changes in bone density in response to treatment are very slow, and repeating the scan every year or two rarely provides information that would lead us to alter the treatment plan. Instead of focusing on the scan results, our attention should shift to more practical and impactful measures. Are you taking your osteoporosis medications correctly? Are you getting enough calcium and vitamin D through your diet or supplements? Are you engaging in weight-bearing exercises to maintain strength? Most importantly, are we actively working to prevent falls, which are the direct cause of most fractures? This involves a comprehensive approach, reviewing all your medications for any that might cause dizziness, ensuring your vision is optimal, and making simple safety modifications in your home. A repeat scan might be reasonable after a much longer interval, perhaps 5 years, to assess the long-term effectiveness of a therapy, but annual follow-ups are often of very low value. The ultimate message here is not to disregard your health, but to intelligently adapt your healthcare to fit your life. Modern medicine has a remarkable ability to find abnormalities, but true wisdom lies in knowing which findings are worth pursuing. After 70, every medical decision should be guided by a simple yet profound question. Will this test or procedure help me live a better, more independent, and more meaningful life? This is the conversation that matters. It's not about surrendering to age, it's about embracing the wisdom that comes with it, and focusing our energy on what is truly important: the quality of your years, not just their quantity.